Dr. Cathleen Gerenger joins us now with how toxin overload affects your sleep. Great to see you, Dr. Cathleen.
Great to see you today.
So I feel like a lot of people don't realize there's a direct link to our sleep and the toxin buildup in our body.
Yes, so toxins enter our body through numerous ways. Our skin, what we put in our skin, and our lungs, what we inhale, and also what we put in our body, foods and environmental toxins as well that we inhale through our lungs.
And another thing that's important to remember is that there are a lot of hormones that are produced while we sleep. Tell us about that link.
Yes, our hormones, especially progesterone and testosterone, is produced. Actually, it goes right down through the liver pathway. A lot of times when we talk about hormones, we're thinking, oh, it's just the ovaries or the testes only. It's like, no, these receptor cells are throughout the whole entire body.
So why does toxin overload actually affect the way we sleep?
Toxins such as like the plastics in our water bottles or pesticides in our grass or the foods that we eat, what happens is that it inhibits the receptor cells of our hormonal pathway. So if you look at this steroid hormonal pathway, everything has to filter through the liver, and the liver activates these hormones.
And that's a lot. And I mean, you show here cholesterol, progesterone, down to testosterone. There are a lot of different areas that people don't realize that are part of that pathway when we sleep.
Yes, and a lot of times patients will come in and they're like, I have trouble falling asleep and I have trouble staying asleep. And my follow-up question is that how many times do you wake up at night? And they're like, oh, well, I think I wake up once or twice to go to the bathroom. And I was like, adults don't wet their bed at night.
Mm-hmm. Yeah, so you shouldn't have to be waking up. So how do you help people sleep better? Because, you know, people have been searching for sleep with over-the-counter medications and sleep medications, prescription, but there's a way deeper issues going on if you're not getting a good night's sleep.
We talk a lot about blue light, and so we say just turn off a lot of your electronics. For myself, I put on airplane mode, especially on my cell phone, so it doesn't interfere with my sleep cycle. And built a sleep routine just like a child. You know, you built a sleep routine, and we as an adults, we have to remember that. I'll set an alarm and say, okay, 9:30, time to wind down, shut everything off, time for you to get to bed.
And then another thing that also helps too, I know you help women and you probably help men as well, but from a female vantage point, balancing out your hormones can help you get a better night's sleep.
Absolutely, especially like we mentioned, the progesterone and also the testosterone, because those hormones are so important for our brain function. The hormones needs to be repaired and regenerate while you sleep.
And do we deplete as we get older? Do we just not have that same level of hormones like the progesterone in our bodies?
Yes, because our circadian rhythm gets a little bit altered through our lifestyle or busyness, or sometimes what happens is that when we're under a lot of stress, our cortisol level starts to kind of like dip, and when it dips too low, again, it disturbs that sleep cycle.
So, okay, so it disturbs the sleep cycle. So when you work with a patient, you're kind of working with them at a holistic level, maybe not just prescribing. You know, a lot of people just go for that sleep medication, but you might be masking something else going on with your health.
Absolutely. And let's talk about melatonin. A lot of times patients say, oh, I take melatonin supplement. I'm not against melatonin supplement, but I'm saying, what is the root cause of your lack of sleep? Where do we start? And I usually start with blood work to see where is that baseline, what do we need to do, and actually adjusting their sleep cycle is so important because that's when your body has to repair.
And we need that REM sleep, we need that deep sleep. Those are the parts of, you know, the sleep cycle that really matter a lot.
Absolutely, because if we're not sleeping, poor concentration, lack of focus, ADD, anxiety, or sometimes depression or psychosis too. There's numerous patients that come to me and say, oh my gosh, I went through a period that I couldn't sleep and my behavior was so off.
Yeah, there's no doubt about it. I mean, I used to work shifts for many, many years, and if I could not keep that sleep cycle in check, and you know, even now as I get older and dealing with hormonal issues, it's so important to get to the root cause of the problem and get it handled so you can get a good night's sleep.
Absolutely.
All right, Dr. Kathleen, as always, it's such a pleasure to have you on Bloom, and I always love your props. It brings everything into perspective for us.
Thank you.
All right, we're going to share Dr. Kathleen's story with you on our website.